Hi, I'm Selena Campbell, Director of Member Services at Progeny, a leading fertility benefits management company. The IVF process involves a few steps, and one of those steps is the medication protocol. This protocol is determined by the doctor, but typically it's the patient who has to administer the medications. This can be intimidating and also a bit confusing for patients. So today, we want to talk a little bit about these logistics, the timing, and the importance of sticking with the prepared protocol. And we're going to do that with the help of an expert, Dr. George Patunakis, a reproductive endocrinologist with RMA Florida. Before we dive in, I just ask that you subscribe and like this video, because doing that helps others to find it. When the decision to move forward with IVF is made, one of the first things a doctor is going to want to do is talk about the medications. The doctors are the experts, but it's important for patients to get some education before they move forward.
The medications with IVF can certainly be intimidating. I think the primary reason is because the medications are shots, and most people have not given themselves shots before, and it's a little difficult to stick yourself with a needle every day. And in this case, usually we have multiple medications that are given. The other thing that's difficult about the medications is that many times they don't have other people in their family that have used the medications before, so all that is also foreign. The names sometimes can be complicated, and what they're doing is a little different than what people are used to, like lowering blood pressure or lowering blood sugar. Those I think most people are familiar with, but stimulating the ovary with hormones, that's a totally different ballgame. So educating patients regarding their medications is important in an IVF cycle because that also helps calm them down and relax some of their anxiety about it. So what I say is we're mimicking what your body would normally do, but we're kind of taking out one of the safeties in terms of allowing the ovary to make multiple follicles, to get multiple eggs, which is the goal of IVF treatment. So I just tell them that we're essentially just giving them what their body would produce, but in higher doses.
Education about the medications and how to store, prepare, and inject them is crucial. So crucial that we have created videos demonstrating exactly how to administer some of the most common fertility medications. Those videos can be found at progeny.com/progenyrxvideos. We'll post a link in the description. Beyond learning how these medications work and how you should handle them, it's extremely important that you help your doctor keep track of your medications. If you perhaps damage some of them in some ways, or maybe you just find yourself running low on medications, well, then you need to speak up and let your doctor know. Running out of medications during an IVF protocol can become a real problem.
So if a patient doesn't have medication at one point during the cycle, number one, it's extremely important for her to tell her doctor and her nurses as soon as possible, because we could generally get medication to her the next day. Many of these medications can be shipped overnight from one of the specialty pharmacies. Running out of medication during an IVF cycle, especially depending on the type of medication, can lead to a canceled cycle potentially, which is why this is so important. This is one of the reasons why we tend to order a bit more medication than we think we may need up front, because running out of medication can be disastrous.
Doctors tend to order excess medications for you to prevent running into a situation where you may run out of medications. And doctors tend to also speak with you regarding the timing that some of these medications are to be administered. It's always best to follow your doctor's recommendations based on the timing of when to do these shots, but in one instance in particular, it's critical that you communicate the timing accurately with your physician.
So during an IVF cycle, there are plenty of injections that are needed. The injection that has the most critical timing is going to be the trigger shot, because a trigger shot will initiate the process of ovulation, and there's a sweet spot where we need to get the eggs before they've fully ovulated, but after they've detached from the wall and started the process of ovulation. For the other shots during the IVF cycle, such as the gonadotropins to stimulate the ovaries, those shots, patients generally take them at night because that's more convenient since they're usually home at that time. The timing of those shots is not as critical as a trigger shot, but you do want to take your shots roughly the same time of day.
It can't be stated strongly enough. The timing of the trigger shot is crucial, as the timing of the egg retrieval is directly related to the timing of the trigger shot. So if for any reason you take your trigger shot early or late, you need to call your doctor immediately.
So the trigger shot is extremely important in terms of timing. If it's taken too early and your treating doctor does not know about it, you may get to your retrieval and your eggs may have fully ovulated at that time. Therefore, there'll be no follicles to get from the ovary, and thus many times you can't get any eggs. If you take the trigger shot too late and your doctor doesn't know about it, then the eggs may not detach, and again, you may end up not getting any eggs from the egg retrieval.
If you're going through IVF, then you've come a long way, and it's important that you maximize your chances of success. So communicate with your care team, ask questions, and do whatever you can to make sure you have everything you need ready to go when you need it. If you want to dive a bit deeper into medications, you can find articles and other materials at progeny.com/education. And as I said earlier, we'll post a link of our medication administration videos below. And if you want to hear some stories from others who have been through fertility treatments, you can find those on our podcast, This is Infertility. Thanks for watching, and don't forget to like and subscribe.